about classification of cancer stage, interesting about science and medicine, prepared by the editors of website netboleznin.ru. Cancer classification depends on the location of disease. Oncological disease can be classified depending on the organ or part of the body where the disease is located, the digestive system, kidney, liver, breast, or depending on the cells that gave rise of a disorder. For example, leukemia is a cancer of the blood, which manifests itself as a result of cancerous proliferation of leukocytes. Classification depending on the nature of disease. Another classification refers to the anatomical characteristics of cancer, localized or diffuse, with or without lymph node invasion. Classification depending on the type of affected cells. Cancer can also be classified based on the appearance of the cells that form the disease. These cells may look normal like other cells in the tissue in which the cancer is located, even if chaotic formations are formed due to rapid multiplication. In this case, we are talking about differentiated cancer. Undifferentiated cancers refer to abnormal cells that are very similar to primitive embryonic cells. These cancers develop very rapidly and are very severe. If the type of the cells is to some extent similar to tissue cells, when we are talking about moderately differentiated cancer. The classification of oncological disease depends on the stage of the disorder, and there are 5 stages. Stage 0 is localized cancer. Stage 1 is a small tumor without lymph node invasion. Stage 2 is a tumor without pronounced size with minimal invasion of the lymph nodes. Stage 3 is a pronounced tumor that extends beyond the affected organ with significant invasion of the lymph node. Stage 4 diffuse tumor with metastasis. The most famous classification of a cancer is the TNA, tumor lymph node metastasis classification. T means the expansion of a primitive tumor, and the state of the lymph nodes, and the presence or absence of distant metastasis. Let's start with the first indicator of this classification, the expansion of a primitive tumor. It is designed by the Latin letter T from tumor, primitive tumor. There are 5 known variations of this condition. T is localized tumor, T1 an insignificant tumor size, T2 tumor size is large compared to T1, T3 tumor size is large compared to T2, T4 invasion of adjacent tissue. The second indicator of this classification is the condition of a lymph node, denoted by the Latin letter N, lymph node. There are 4 known states of this indicator. For the first, N0, lymph nodes are not affected. N1, an increase in the number of affected lymph nodes or lymph node involvement at long distance. N2, the increase in the number of affected lymph nodes is greater compared to N1, and the involvement of a lymph node and at even great distance compared to N1. N3, the increase in the number of affected lymph nodes is greater compared to N2, and affection of a lymph node at even greater distance compared to N2. And the last, third indicator of this classification, the presence or absence of distant metastasis, is indicated by the Latin letter M. There are 2 variations, M0 without distant metastasis, M1 presence of distant metastasis. The incidence of cancer in development countries. Cancer is a disease has been known since antiquity. In development countries, it is the second leading cause of death after cardiovascular disease. In Europe and North America, there is a predominance of lung cancer, which is associated in 90% of cases with smoking. Colon or rectal cancer associated mainly with diet. And breast cancer, the cause of which remaining known. In Africa, the incidence of liver cancer has increased in area where hepatitis B is prevalent. Another common cancer in poor countries involved is cervical cancer. The incidence of this type of cancer is attributed to poor hygiene condition that increase the incidence of risk of disease. What do statistics on cancer look like? Cancer is characterized as a severe disorder by the level of severity vary from one type of cancer to another. Many cancers are benign, while some tumors of the skin or digestive system are considered completely eliminated if treated. If we take into account the complete statistic of the incidence of cancer, when we can assume that 50% of all patients are completely healed. The relationship between age and gender with the risk of developing cancer. People are not equal in face of a cancer risk. Age is the main risk factor. 1% of all cancers occur before the age of 15, while 55% of cancer are seen in people over 65. 57% of cancer are seen in men and 60% of death are also observed in men. That's all. Thank you for your attention. This material has been prepared on the basis of a material from website netballistening.ru. Attention, this material is for information purposes only. When observing various unusual symptoms, it is recommended to consult a doctor. Subscribe to our channel. Thanks. Bye bye.